The video
Based on the
opens with
latest
a direct,
scans, we have determined that
unsettling
surgery
truth
is
that immediately
necessary
puts
to
the
address
viewer in
the
a
issue.
vulnerable, relatable
We should
position.
discuss the next
One in
steps.
every 2 adults has heard the words, "You need surgery," at some point in their lives. And for many, that moment comes quickly, unexpectedly, and without a full understanding of what alternatives exist. The tone is not aggressive, but firm and grounded in reality. The viewer is not being blamed. They are being invited to pause and think. The introduction expands into the idea that modern healthcare, while advanced
We need an
and
immediate path to
life-saving in
surgery.
many
This is
situations,
emergent.
is also
Room
structured
4
in
is
a way
prepped
that can
and waiting.
sometimes move too quickly toward intervention, especially surgical intervention, without fully exhausting conservative options first. This is not framed as a conspiracy, but as a system under pressure.
We are ready to
where
begin
time,
now.
incentives,
Wait,
and
I'm
workflow
scared.
often compress decision-making
Everything will
into
be all
shorter
right.
windows than
Just take a
patients
deep
truly
breath.
need. The narrative then introduces a core principle that anchors the entire video. The best operation is not the most advanced one, or the most expensive one, or even the one performed by the most skilled surgeon. The best operation is the one that was never required in the first place. This is framed
Based
not
on
as
these results, the
anti-surgery
previous
rhetoric,
diagnosis seems
but as a
unlikely. We have a
reflection
clear
of
path
long-standing
forward.
So the
medical
surgery
wisdom.
might not be
Surgery
necessary
has a
then.
place.
That's correct. We'll
And
monitor
in
it
some
closely.
cases, it is absolutely necessary and life-saving, but it is also irreversible. Once tissue is cut, once structures are altered,
Right here,
body
between the
adapts
L4 and
permanently.
L5 vertebrae,
That permanence
you can see the
deserves
disc is
respect.
bulging. This
Not
is what's
fear,
causing the symptoms you've
but
been
respect.
experiencing.
The viewer is guided to understand that the decision to operate should come after a process, not before one. It should come after understanding, not confusion. After exploration, not pressure. And most importantly, after giving the body a fair opportunity to respond on its own terms. From there, the video transitions into a structured
Slowly
exploration
extend
of 5
against the
common
resistance.
surgical scenarios
That's
where
it.
patients are
Now
often
bring it back
offered
gently.
surgery before a full conservative
good.
pathway has been explored. Each section follows a consistent internal rhythm, a familiar situation, what most people are told, what is often overlooked, and what a more complete approach might look like. But beyond structure, each section also carries a deeper message. The body is not passive, it is responsive. It adapts to stress, to movement, to habits,
So the
and to
primary
time.
benefit is
and when we
significant
ignore
pain
that
relief.
adaptability,
But we
often
must
move to
consider the
intervention too
risks.
quickly.
Risks.
The first section addresses
As we can
lumbar
see,
disc herniation
early surgical
and spinal
intervention
surgery.
resolves the immediate issue,
The viewer
yet
is placed into
conservative
a common
treatments
scenario.
often lead to a more
Back
complete
pain, an MRI scan, and a report showing a disc bulge or herniation. The emotional reality is acknowledged. Seeing something wrong on a scan is alarming, and when a specialist recommends surgery, it can feel like the only logical next step. The outline then carefully reframes this moment. Imaging findings are not the same as a diagnosis. Many people have disc changes without pain,
Right here,
and not
between the
every structural
L4
finding
and L5
requires surgical
vertebrae,
correction.
you can see the disc
discussion then shifts
protrusion
into when
causing the
surgery is truly
compression.
necessary, introducing clear red flags such as progressive neurological deficits, significant weakness, or loss of bowel and bladder control. These are not vague suggestions, but firm boundaries. At the same time, the outline emphasizes that in many cases of non-emergent back pain and sciatica, a structured, consistent
But the
conservative
scan clearly
program
shows the
focused on
herniation. Why
movement,
does it hurt so much?
strength, and
Looks
functional
perfectly healthy to me,
rehabilitation
Doc.
can lead to meaningful improvement. The key message
The
is not
results are
that
back,
surgery
and
is wrong,
unfortunately, they confirm our
but
concerns.
that timing matters.
You need surgery,
and
and it
rushing
needs to
into
happen
it without
quickly.
a full trial
We're
of
scheduling it for
conservative
tomorrow
care
morning.
can lead to unnecessary intervention. And more importantly, it can take away an opportunity to build a stronger, more resilient body that would have reduced future problems as well. The second section focuses on hemorrhoid surgery. It begins with the discomfort and embarrassment many people feel when dealing with this condition, which often leads them to accept surgical recommendations quickly just to resolve the issue. The outline acknowledges that surgery can be highly effective, especially in advanced cases, but introduces the idea that not all cases are
Okay,
equal.
gently
It
tilt the
shifts
pelvis
attention
now.
to contributing
That's
factors
it.
such
Now
as
lift
chronic
slowly,
straining,
visualizing each
bowel
segment,
habits,
and remember to breathe
diet,
deeply into your belly.
hydration, and daily lifestyle patterns that affect pressure in the lower digestive tract. The viewer is encouraged to consider whether these underlying contributors have been addressed before moving toward surgery. The tone remains grounded and realistic. There is no promise of instant reversal, but there is a clear message that for many individuals, meaningful improvement can come from correcting these patterns first. Small, consistent changes often create more lasting results than immediate intervention. Surgery is positioned as a valid option when conservative measures fail, not as the automatic first step. The third section explores diastasis recti, particularly in women after pregnancy. The outline brings attention to the emotional aspect of this condition, not just the physical separation of abdominal muscles, but the loss of strength, stability, and confidence many women experience. It highlights how quickly surgical repair can be suggested when the separation appears significant. Then it introduces a different perspective. The body, especially muscle and connective tissue, has the capacity to adapt and strengthen when given the right stimulus. With targeted rehabilitation focusing on deep core activation and proper movement patterns, many cases can improve significantly over time. The key distinction is emphasized between structural appearance and functional strength. Surgery can bring tissues together, but it does not automatically restore strength or coordination. The viewer is encouraged to consider whether function has been fully rebuilt before choosing a structural fix. The message is empowering without being unrealistic. Not every case can be resolved conservatively, but many can be improved more than people are led to believe. And even in cases where surgery is eventually chosen, entering that process with a stronger, more functional core leads to better outcomes and faster recovery. The fourth section turns to varicose veins and venous procedures. The outline begins by acknowledging how common and frustrating this condition is, especially for individuals who spend long hours standing or who have gone through pregnancy. The visible nature of the problem makes it feel urgent, and modern procedures promise quick cosmetic improvement. The narrative then expands the conversation beyond appearance. Veins are part of a larger system, influenced by circulation, movement, and daily habits. The outline introduces the idea that pressure in the lower body, inactivity, and prolonged standing or sitting can all contribute to the development and progression of varicose veins. While procedures can remove or close affected veins, they do not automatically change the conditions that led to the problem. The viewer is encouraged to think in terms of long-term outcomes rather than short-term fixes. Addressing movement, circulation, and lifestyle factors first can improve results and reduce recurrence. And more importantly, it restores a sense of control to the patient. Instead of reacting to symptoms, they begin to influence the system that created them. The fifth and final section addresses pelvic organ prolapse. This is presented with sensitivity and respect, recognizing that many individuals delay seeking help due to discomfort or embarrassment. The outline explains that prolapse is often a gradual process, developing over years rather than appearing suddenly. This gradual progression is framed as both a challenge and an opportunity. The challenge is that people adapt and ignore early signs. The opportunity is that early intervention can be highly effective. The viewer is introduced to the role of pelvic floor strength, core stability, and daily habits in supporting pelvic structures. Conservative approaches such as pelvic floor therapy are positioned as powerful tools when used early and consistently. The outline also clearly states that in advanced cases, surgery may be necessary and appropriate. The key message is timing. Acting early can change the entire trajectory of the condition. Waiting too long often removes options that once existed. After exploring all 5 scenarios, the video transitions into a unifying perspective. These conditions are not isolated problems. They are different expressions of how the body responds to stress, imbalance, and time. The human body is adaptable, but it requires the right conditions to heal and function well. When those conditions are not addressed, symptoms can persist or return, even after intervention. This is not a failure of surgery, but a reminder that surgery alone does not always resolve the underlying drivers. Real healing often requires participation, not just intervention. The outline then shifts into practical guidance. The viewer is given clear, actionable steps they can take when faced with a surgical recommendation. Seek a second opinion, especially for non-emergency procedures. Ask whether all conservative options have been explored and what those options specifically involve. Understand the timeline of the condition, whether it is stable, improving, or worsening. Identify red flag symptoms that require urgent care so that caution does not become dangerous delay. This section reinforces responsibility. The goal is not to reject medical advice, but to engage with it more deeply and more thoughtfully. The closing section returns to the emotional core of the video. This is not about rejecting modern medicine. It is about participating in it more consciously. It is about recognizing that your body is not a problem to be fixed as quickly as possible, but a system that deserves understanding and patience. The viewer is reminded that decisions about surgery are among the most important health decisions they will make, and that taking the time to fully understand their options is not hesitation, it is wisdom. It is self-respect. It is the difference between reacting out of fear and deciding from a place of clarity. The final message is simple, clear, and grounded. Surgery has its place, and when it is needed, it can change lives. But in many cases, there is a window of opportunity before that point. A window where the body can respond, adapt, and improve with the right support. The goal is not to avoid surgery at all costs, but to ensure that when surgery is chosen, it is truly the right choice, made at the right time, for the right reasons. And sometimes, the most powerful decision you can make is not to act immediately, but to understand fully before you do.